Hi, I'm Dr. Fara Kamangar, board certified dermatologist. We're joined here today by Dr. Tina Bhutani, who is an expert in psoriasis and psoriasis therapeutics. She is the co-director of the UCSF Psoriasis Center, assistant professor of dermatology at UCSF, and director of the clinical research unit. We're very lucky to have her here today. A lot of our patients in dermatology during the COVID pandemic have had a lot of questions about their medications that they're on for psoriasis. So these are biologics, systemics, and dermatologists get called all of the time with these questions. So we're so lucky to have an expert here to answer some of these for us. So thank you so much, Dr. Bhutani, for joining us. And I'll just go right into our questions. The main one being, what do you generally recommend when our patients do call us and ask, should they go ahead and stop their therapies?
Yeah, I think it's a really loaded question, and there's a lot of things that need to be considered if that's the case. But what I try to frame it to patients, I think there's two major questions that we don't really know the answers to. The first question is, do these therapies increase their risk of developing SARS-CoV-2, the novel coronavirus? And then the second question is if they were to develop if they were to develop COVID while on one of these therapies, do these therapies actually worsen their course or make their course more severe? We don't know the answer to either of these questions because, as we mentioned, this is a novel coronavirus, but we can make some inferences based on data that we have from other viruses and data that we have from clinical trials with these drugs. So the first question is, do these treatments increase their risk of developing upper respiratory tract infections or viral infections? And the answer is, for the biologic agents, probably not. So for most of the biologic agents, looking at their clinical trial data, it's really promising. Most of the drugs, their rates of upper respiratory tract infections, rates of things like influenza, even some rates of serious infections like pneumonia, were pretty comparable to the placebo groups. So they're actually, we consider them to be fairly safe. With other drugs, like other systemic agents such as methotrexate or cyclosporin that are more broad immunosuppressants, they're not as targeted as the biologics. For those drugs, we do think that there's probably an increased risk of developing infection. So for patients on those drugs, we might actually recommend that they either reconsider continuing their treatment during this time, especially if they're in a high-risk population, such as if they are older, age over 60, if they have other medical problems such as heart disease, lung disease, diabetes, or if they're high risk for exposure, like if they're healthcare workers or if they're working in grocery stores, things of that sort. So with the more broad immunosuppressants, we would consider talking to them about holding off if possible. In some cases, their background psoriasis is so severe that if we stopped it, they would end up in the hospital anyways. And so we really have to take that into account as well. With the biologics, because they're more targeted and they don't have as much of a risk of infection, then for the most part, we wouldn't ask them to stop, or we haven't been asking them to stop. But that being said, those same things need to be taken into account, like their age, their other medical problems, and their risk of exposure. And if patients are feeling hesitant, obviously, then we can talk about them stopping. With the biologics, we can also consider decreasing doses, like taking the biologics less frequently, or getting creative with the dosing there as well, just to decrease risk, if any.
That's great. There's a lot of nuances there. So I think the most important thing is getting in touch with your dermatologist and talking about these. But it's really great to have the guidelines that more specific your immunosuppressant is, probably the better. You want to be blocking the least amount of,
Right. Yeah, yeah,
part of your immune system. I
yeah.
see that. And then for the people that do have severe disease, I guess, what is the risk of stopping? What are some reasons to maybe consider not stopping or continuing therapy?
Yeah. So as I already mentioned, the biggest risk is that your psoriasis will come back. And if you had severe psoriasis to start with, especially if you had a type of psoriasis like erythrodermic psirosis or pustular psoriasis, then obviously, your skin disease could be severe enough to cause other problems that might be worse than developing a mild viral infection. The other risk to stopping or holding the biologic agents is that with certain agents, the effectiveness of the drug decreases if you take a break off therapy. So what I usually tell patients is that if you take a break from treatment, in that break time, your body somehow learns to outsmart the drug. And so when you take it the second time after that break period, it doesn't work as well. So that's, one disadvantage to doing that. That being said, we're now in a very fortunate place with psoriasis treatments where we have 11 different biologics approved for psoriasis and a couple more in the pipeline. So if one drug stops working, we have, other options that we could use. But for patients who, let's say, have tried and failed a lot of those therapies already, we just want to be extra careful because we might not have a lot of options left for those patients if their one drug stops working.
And that's a really good point you make too, that it's important for us as dermatologists just to make sure we keep our patients out of the urgent care and out of emergency medicine. I think that's a lot of the role of us as dermatologists now, is try to manage everything to keep it from getting so severe that patients then do have to go to these higher risk
Exactly. Yeah.
places. That's very important. And then, so that's another really big question, is which, as the pandemic kind of grows, what if you do have psoriasis, you're on a biologic, you're on some systemics, and then you become positive with COVID, and you're actually either suspected or you do test positive? Do the recommendations change at that point?
Right. And so, like I mentioned, the second biggest question is, do these drugs actually change the course of your disease? Like, would your disease course be more severe if if you got coronavirus while on one of these drugs? And the answer is, we just don't know. I think we're learning so much about this virus every single day, about how it infects people, and different factors that might influence the severity of the course. So we don't know the answer to that question. So the recommendation at this point is, if you develop symptoms that are highly suspicious for SARS-CoV-2, or if you or test positive, if you absolutely test positive for it, then you should stop your medication right away, regardless of the treatment, either the targeted or non-targeted therapies. And just to be extra conservative, we've been asking patients to not restart therapy for at least 30 days after full resolution of their symptoms. So that means like the end of their cough, the end of their symptoms. So waiting another 4 weeks or a month after that to restart therapy. And that's just to be extra conservative because we don't have a lot of information.
That makes a lot of sense. Just cover all our bases, and until we have more information about the virus. That's usually what we do with most severe infections as well, correct? Even outside the time of COVID, if somebody has a serious flu or hospitalized, that sounds on par with recommendations that we'd make.
Right. Yeah, absolutely. So I always tell people, if it's a mild infection, runny nose, stuffy nose, it's probably okay to continue their treatments. But if they do develop a severe infection, fever, body aches, just feeling really, ill, then they should definitely stop their treatment as well. The only difference here is, in those situations, I usually say, once you start to feel better, go ahead and restart your treatments. But in this case, because the viral shedding seems to be a little more prolonged with this particular virus, we're recommending patients to wait that extra month.
That's really great. Thank you so much for taking the time to answer our questions and always being a resource for the dermatologist and the patient. So thank you so much, Dr. Bhutani, for
Thank
joining
you.
us.
Thank you for having me.